Hi, my name is Brandi, and I'm a student at Maryville University, and I'm going to do my head-to-toe assessment for the Advanced Health Assessment class. This is Kathleen. She's my volunteer today. So before we enter the room, I had Kathleen empty her bladder. I had her change into a gown. We went ahead and took some full set of vital signs with her height and weight. We also tested her distant vision with the Snellen chart and her near vision with the Rosenbaum chart. Both were 20/20, and that was testing cranial nerve number 2. I'm going to go ahead and wash my hands. I can see upon general inspection that Kathleen has good hygiene. On the way back to the room, I saw that her gait was stable. She is appropriate, has an appropriate manner. She is well nourished. Her speech is clear and articulate. So we're going to go ahead with the head and face inspection. I'm looking at the skin. There's no signs of infection. Her skin is unblemished and uniform. Her head is upright and still. It is round and normocephalic. There's no obvious signs of masses. I can see her external characteristics are symmetric, and her hair is evenly distributed. So I'm going to go ahead and palpate for any depressions or masses. I'm noting the texture of her hair. It is thin. There's no split ends or falling out. I'm going to palpate her facial bones for any nodules or masses. I'm going to palpate the frontal sinus and the maxillary sinus for any tenderness. I'm going to palpate her temporomandibular joint for any pops or clicks. So go ahead and open your mouth and close. Okay, good. While we're here, we can test cranial nerve 5 and cranial nerve 7. So cranial nerve 5, we're going to test with the light sensation. So I'm going to have you close your eyes, and I'm going to touch places on your face, and I want you to tell me if you can feel it.
Yes.
Was it symmetrical? Mm-hmm. In here?
Yes. Yes.
Okay, good. And we'll test cranial nerve number 7. I'm going to have you do various movements with your face. So I want you to wrinkle your forehead, squeeze your eyes shut. I want you to smile, puff out your cheeks, and clench your jaw. Okay? Good. And now we're going to look at your eyes. Inspection of the eyes. There's no edema. There's no signs of infection. They're symmetric. Her eyebrow hair is evenly distributed. Her eyelashes curve slightly outward. The sclera is white. The conjunctiva is pink and moist. No signs of irritation. I will palpate the lacrimal apparatus. No signs of excess tearing. And we will we'll test cranial nerves 3, 4, and 6 for ocular motor function. So I'm going to first get my pen light, and I'm going to check the pupillary response for equal, round, and reactive pupils. So I want you to stare at an object behind me, and I want to shine your light for direct and consensual. Direct and consensual. Okay, and then I want to do an cover test. So I'm going to have you put a hand over one of your eyes, stare at the wall behind me, and take it down. Good. And the other one. Good. And that's testing for any nystagmus or eyelid drooping, which there are none. I'm going to do the 6 cardinal gates. So I want you to follow the tip of the pen without moving your head. Follow my light. And convergence. Good. And now we're going to test your peripheral vision. So I want you to cover one of your eyes, and I want you to tell me when you can see my fingers.
No. No.
Okay, and the other?
No.
Good?
No.
Good. Okay, and now we're going to inspect the red reflex and look at your eye with the ophthalmoscope. So I'm going to look at her right eye with my right eye, and starting at 0. Okay. And the same thing on the left eye, her left eye and my left eye. Good. Okay, so now we're going to move on to the ears. I can see that they're symmetrical. The ears are aligned with the outer canthus of her eye. There's no inflammation or signs of infection. When I palpate, they're mobile, firm, non-tender, no signs of masses or lesions. I am going to look at the inner ear. Oh my gosh. Okay. And the inner ear is without redness or signs of inflammation. There is no, the tympanic membrane is a pearly gray. There's no inflammation, there's no perforations, bubbling, retractions. There's a light reflex with the bony landmarks, and I repeat that on the other ear. So now I'm going to test cranial nerve 8, which is the vestibular cochlear nerve, and we're going to do a couple tests. I'm going to do a whisper test. I want you to cover one ear. I'm going to walk behind you. I'm going to say a common word, and I want you to repeat it.
Apple.
Okay, and the other one?
Banana.
And now we're going to do the Weber test. So with this tuning fork, I'm going to strike the tuning fork and place it on your head. I want you to tell me if it's symmetrical on both sides.
Yes.
Okay. And now I'm going to strike it again. I want to put it on your mastoid bone. I want you to tell me when you can no longer hear it, and then I'll move it to your ear, and I want you to tell me when you can no longer hear it after that.
Okay.
Okay. Okay, and that was testing bone conduction versus air conduction. Air conduction should be 2 times greater than bone conduction. Okay, so now we're going to go to the mouth and the pharynx. I can see on her, or the nose. Okay, the mouth and the pharynx, I can see that her lips are pink. They're moist, there's no cracking or lesions. I'm going to look into your mouth, so open. Okay, I can see that the mucosa is pink and moist. There's no inflammation. Lift your tongue up. The floor is without any lesions or signs of oral cancer. Her gums have tight margins to the teeth. There's no signs of inflammation. There's 28 white teeth without discoloration. Say ah. The uvula is midline. The hard palate is intact. The soft palate is intact and continuous with the hard palate. There is no odor. The tonsils are a grade 1, and the posterior and anterior pillars are intact as well. I'm going to test cranial nerve 9 and 10, and I'm going to do an ah, a gag reflex, and have her swallow. So first say ah, ah, and gag, and we'll have you swallow, and that is intact. Okay, so now we're going to look at your nose. I can see that the nose is midline. There's no flaring. There's no discharge. I'm going to look up the nose, and I can see that the septum is midline. It's not deviated. It is moist. The terminates are the same color as the surrounding tissues. There's no polyps or obstructions. I'm going to test the nasal patency of your nose, so plug one nose. Look inside. Okay, good. And the other, and take a breath. Good. Okay, so now we're going to inspect the neck. I can see that the muscles are symmetrical. There's no obvious masses. The skin is smooth and uniform. There's no obvious thyroid, and there's no venous jugular distension. I'm going to have you do some active and passive range of motion. So I want you to flex your neck and extend in your ear to your shoulder, and the other, and look over your shoulder. Good. And then we'll go ahead and do some resistance. So forward and backward, side to side, and then shrug your shoulder. And then a shoulder shrug also tests cranial nerve 11. So now we'll look at your upper extremities. I can see that the muscle mass is symmetric. The size and length are symmetric, even hair distribution. The skin is warm, dry, and intact. I can see the nail beds are pink. The nail plates are hard and smooth. There's cap refill is less than 3 seconds. There's no signs of cyanosis or edema. And I'll test the brachial pulses and the radial pulses, and they're both strong and regular. Okay, so now we're going to move to the posterior back. So if I can have you flip around. So looking at the skin, it's uniform. There's no obvious signs of masses. Her AP diameter is less than her lateral diameter. I'm going to palpate for any masses. Okay, and then I'm going to percuss the cristobvertebral angle for tenderness. Okay, good. Now the lung portion of the back, I can see that her respirations are even and unlabored. I can see chest rise and fall with the respirations. I will go ahead and palpate for thoracic expansion. I'm going to place my hands here, and I want you to take a deep breath. Okay, and I'm just making sure that's symmetric movement. I'm also going to palpate for tactile fremitus, and I'm going to have you say 99 when I place my hands on your back, and I'm looking for any increase or decrease in fremitus.
99, 99, 99.
Good, and then I'm going to go ahead and percuss the posterior chest. I'm listening for resonance and the lateral, comparing side to side. Good. And we'll also percuss for diaphragmatic excursion. So I'll get some pieces of tape. And what I want you to do, when you're ready, I want you to take a deep, slouch over a little bit, take a deep breath in and hold it. And I'm going to percuss to dullness. Okay, and take a breath. And I will mark this site. When you're ready, I want you to take a deep breath in, exhale completely, and hold. And I will percuss up. And I will mark this site. This should be 3 to 5 centimeters, and I will do the same thing on the other side. Okay, so now we're going to do your, go ahead and flip back around. We got some more auscultate. We auscultate the lung fills, so take a breath. Okay, and the lateral. Okay, good. Now we're just listening for any advantageous breath sounds. Have you turn around, and we will do the anterior lung and chest on this aspect. So I'm going to see, again, her skin is symmetric. There's no signs of any infections or obvious masses. Her chest rise and fall with each breath sounds. There's no accessory muscle use that's visible. There's no pulsations or heaves. So I'm going to palpate again the chest wall, and I'm going to palpate the pericardium and the apex for any lifts or heaves. Now I'm going to, again, do the tactile fremitus, so we're going to say 99.
99, 99, 99.
Good. And then I'm going to palpate the lymph nodes, the occipital, the preauricle, postauricle, preauricle, tonsillar, submandibular, submental, the superficial cervical, the post-cervical, tilt your head to the side, the deep cervical, supraclavicular, infraclavicular, and the axillary. Okay, now we're going to percuss for resonance on the anterior chest. Okay, and now I'm going to auscultate the breath sounds. Go ahead and take a deep breath. And while I'm here, I'm going to go ahead and auscultate the arteries. So the aortic, pulmonic, Erb's point, tricuspid, and the apical. The mitral. Okay, and now we're going to do the abdominal, so I want you to go ahead and lay down. Come over here so we can see. Go ahead and turn your shirt up. And so what we're looking at is the contour. Her skin is uniform, it's flat, it has muscular contour, there's no obvious pulsations or peristalsis. I'm going to go ahead and auscultate the vowel sounds in all 4 quadrants. And while I'm here, I'll go ahead and auscultate the arteries. So the aorta, the renal, the ischial, the iliac, and the femoral. Okay, and now we're going to percuss the abdomen. I'm going to percuss all 4 quadrants, noting tympany and dullness over organs. Okay, and now I'm going to percuss the liver border. So I'm going to start up. Okay, and I'll mark that. And I'll mark that, and that should be 6 to 12 centimeters. I'm going to percuss for splenic dullness, so if you can turn on your side. Okay, and you can turn back over. Now we're going to do some light palpation. Light palpation just for any muscle tenderness. Okay, and then we'll go ahead and do some deep palpation. So take a deep breath in. I'm going to palpate for the liver border. Okay, and then I'll palpate for the spleen, which is not normally felt. And then I will palpate the left kidney and the right kidney. Okay, I'll also palpate the aorta while I'm here. Okay, and then I'm going to have you sit up. As she sits up, I'm going to look at her muscle tone and make sure those are all intact. Okay, so now we're going to look at your feet and legs, the lower extremities. I can see that the muscle mass is equal, length and size, hair distribution is all even. I'm going to feel the skin is warm, dry, and intact. There's no signs of edema or any cyanosis. I'm going to feel the popliteal pulse, which is a 1+ on both sides. I'm going to feel the dorsalis pedis and the posterior tibial, and I would do the same thing on the other side. Now we're going to test the musculoskeletal, so I'm going to test your reflexes. So lay your arms to the side, and I'm going to do the brachial. We're looking for a hand twitch. Okay, good. And then I'll do the patellar. And we would do the Achilles tendon. Okay, and I will do muscle strength. So I want you to hold your hands up for me, push against me, pull, your legs, push, pull, and your feet, push, pull. Good. Okay, so go ahead and come here so we can do your cervical and lumbar spine. I want you to go ahead and touch your toes. And here I'm going to notice that her spine is midline. There's no signs of scoliosis or kyphosis. Her hips are aligned. Go ahead and stand up and do extension. Turn your back. Okay, and can you lean to the right, lean to the left, and rotation. Then go ahead and squat. This tucks the hip flexors. Good. Okay, and so I'll go ahead and do a rundown of the cranial nerves. Cranial nerve number 1 was the olfactory nerve. We didn't have the equipment to test it here, but you could test it. That's testing smell. Cranial nerve number 2 is the optic nerve. That was tested using the Snellen and the Rosenbaum charts. cranial nerve number 3, which is the ocular motor, 4, the trochlear, and 6, the abducens were ocular motor nerves, which we tested with the 6 cardinal gaze. Cranial nerve 5 is the trigeminal nerve. We tested that with the light sensation of the forehead, cheeks, and chin. Cranial nerve number 7 was the facial nerve. We did various facial movements. Cranial nerve 8 is the vestibular cochlear nerve. We tested that with the Weber and Rhine test. Cranial nerve number 9 is the glossopharyngeal. Cranial nerve 10 is the vagus nerve. Those were tested with the ah and the gag reflex and the swallow. Cranial nerve number 11 is the accessory nerve, and that was tested with the shoulder shrug. And cranial nerve 12 is the hypoglossal nerve, which we can test with the tongue range of motion. So stick your tongue out, move it side to side, up and down, and then push against my fingers. Okay, and those were all intact. And this concludes the head to toe assessment.